Okay, everyone. I think we'll kick off. We're 2 or 3 minutes over 4 o'clock. We've got about 30 people on the board, and there's a likelihood we could be joined with a few more, judging on the registration numbers. Owen and Charlie have very kindly agreed to do a couple of presentations for this webinar Wednesday. Owen is going to be talking to us about your role in fresh cow management, and Charlie is going to be talking to us about bioenergy ingredients, a company he works for, discussing a product called Glycol 40 and how it helps promote a healthy rumen environment, amongst other things, in fresh cows. A little bit of housekeeping. All the cameras have been turned off, microphones muted. Owen's talk is going to be about 30-35 minutes. Charlie's about a quarter of an hour, and there'll be time, we think, for about 10-15 minutes of questions at the end. If you could type those into the Q&A or the chat, we'll pick those up at the end. There are a couple of, I believe there's a couple of poll questions at the start of Owen's presentation, so take part in those, please. And without further ado, I will hand over to Owen to start the meeting off. Thank you.
Thanks, David. Good afternoon, everyone. Yes, I've got a couple of poll questions, and Charlie's got one as well. So, yeah, challenges during fresh cow management and how you as a vet can help, and all in 35 minutes. I'm sure there'll be questions at the end because I won't manage to do it justice, really. It's a big old subject, but let's have a go how we get on. So, what we do in this webinar, we'll look at some detail on the metabolic, and by that I mean the nutritional challenges during the transition period. So I'm not looking at some of the things like, cell count control, mastitis, dry cow therapy, and so on. We're just looking at the kind of nutritional elements, and specifically hypocalcemia, which I've spelt wrong there. Look at that. Ketosis and subacute rumen acidosis. And then what you as a role can do to kind of wisely bring extra value during management of these common dairy nutritional problems to your herds. And then I'll introduce to Charlie, who will talk about the Glycol 40. And I've been aware of Glycol 40 for a couple of years, and I think it's a fascinating product. I wish I knew more about it, and I'm looking forward to learning a bit more about it from Charlie. Okay, so here's your first poll question. I'll read it out and then I'll launch the poll. So just so I can give an idea a little bit about my audience, or our audience this afternoon, here's the question. How confident do you feel about your ability to advise dairy farmers over nutrition? Is it A, not confident, B, a little or moderately confident, C, confident, or D, very confident? So launching the poll now. That should come up on your screen. Give you a couple of minutes or so to answer that. Answers coming in thick and fast when we get a reasonable proportion of people voted. So far, 3/4 of people have voted. Anyone else? Okay, I'll end the poll. Just a couple more come in. I'll end the poll and show where the answers are. So you should now see the results of that poll, where the most prevalent answer was a little or moderately confident. A couple of people said confident, and a few people said not confident, and no one said very confident. So that's the first one. It's for your interest as much as for mine. Let's move on to the next question. How much involvement do you have with your farmers in terms of dairy cow nutrition? So not much, and that suits me fine, or not much, and I'd like to do more. A moderate amount, and that suits me fine. A moderate amount, and I'd like to do more. A lot, and that suits me fine. Or a lot, and I'd rather do more. Now, if anyone out there is wanting to do less involvement, you haven't got an answer to suit you, I'm afraid, because I'm kind of assuming that it's either suits you fine or you'd like to do more, but maybe that's a wrong assumption. Anyway, I will launch the poll question to you now. Here we go. So you've got the opportunity to put your answer. Okay, quick on your buttons today, because that's almost as many people answered this one straight away as the other one after a couple of minutes. So we'll end the poll and I'll show you the results. So the most common response there was not much and I'd like to do more. A couple of people, not much, that suits me fine. A few people, not much, I'd like to do more. And there's one person, a lot, and I'd rather do more. So yeah, that is interesting to know that. There is a desire, I think, to do more. And that kind of reflects what I thought. Certainly my experience of life in practice is very much that it's an area we don't always find it easy to get our teeth into. Sometimes it's difficult to know what our involvement is compared to the nutritionist. Farmers don't always look to us for work in this area, so I'm always interested in how we can really add value in the area of nutrition, and hopefully what we discussed today will help. So thank you for that. Moving on, I'm going to ask you to consider the energy challenge of this fresh calved cow. She's just, let's say, I don't know, second lactation, third lactation cow. She's just dropped her calf and she's going to be producing 30 litres of milk a day in a short order, certainly within a week you'd expect, and then rising beyond that, 40, 50 litres a day. The first question though is, how much energy will this cow need to produce 30 litres of milk? I've not done this as a poll question, I'm just posing the question, I'll give you the answers. And the second is, well, how much feed will she need to eat in order to meet that energy requirement? In terms of energy, she'll need 245 megajoules or thereabouts. And that is because she'll need 80 megajoules a day maintenance. That's what typically a Holstein cow needs as a maintenance requirement. And then round about 5.5 megajoules per litre of milk produced. So you add that together, it comes to 245. I'm sure some of you will remember it and some of you won't remember it, that fag packet kind of calculation that you might have covered at university. Now, how much is she likely to eat, or how much does she need to eat or consume to meet that energy requirement? Well, the answer is around about 20 kilograms dry matter intake, and this is the calculation. So that's based on she needs 245 megajoules a day, and it would be impossible to feed a cow a higher energy density of 12.5 megajoules per kilogram dry matter, and even that's pushing it a little bit, without, I've put inverted commas, blowing her socks off, but really causing acidosis. So, you know, a high yielding fresh calved cow diet would typically have 12 to 12.25 megajoules per kilogram of dry matter. And if that's the case, you'd need to be eating 20 kilos of that every day to meet that energy requirement she has. However, what's her realistic dry matter intake? Well, this graph shows the dry matter intake of a cow around the calving period, so 3 weeks before to a month after calving. And you see that before calving, she'll be, you know, hovering along at around about 12 kilos dry matter intake per day. Then there's a dip, which is a sharp dip actually at the point of calving, and then it steadily rises after calving to reach actually above 20 kilos dry matter intake per day for a Holstein cow. A lot of Holstein cows will be easily achieving 24 kilos of dry matter intake per day, but it takes a little while to get there. And then that time that it takes to get there, she's producing 30 odd litres of milk or more. That's when she's got the negative energy balance period. So the dry matter intake falls around calving, therefore there's an inherent dry matter intake drop that occurs around calving, and that leaves a gap of, well, probably 4 weeks for most cows. And the lowest point of that is around about 2 weeks into lactation, when she's producing a lot of milk, but she's just not achieving the intakes yet. And this graph shows how that energy gap occurs. So it's really just showing the energy requirement versus her energy intake, and it takes a little while to catch up because of the dry matter intake drop, and that gives a challenge period when there's an energy shortage. Now, on top of that, I'm going to come back to the energy in a minute, because the energy is probably the main focus of certainly what I will talk about. But I want to just look, before coming back to energy, at calcium, because on top of the energy requirement, there's a sudden requirement for calcium around calving. Obviously, every litre of milk contains about 1.22 grams of calcium, so a cow giving 30 litres of milk is requiring quite a wedge of calcium, certainly more than you could snort in a day if you had a cocaine habit. And the milky cow diet normally is well supplemented with dietary calcium, but that sudden and huge demand for serum calcium does create a challenge. So hypocalcemia is common. And I would like to just draw attention to the subclinical hypocalcemia, the ones that occur that go under the radar because the cow hasn't got actual full-blown milk fever. And research has been done in this area. So 2 studies shown on this graph here, one from German herds, around about 1,400 cows, and one from USA herds, again, around about 1,400 cows, blood sampling cows within the first 48 hours after calving, and looking at serum calcium levels. And this is stuff that you can do in practice. 2 megamoles per litre of calcium is the threshold, below which is hypocalcemia. And a lot of those cows actually, well, some of those cows will be clinically hypocalcemic, in other words, have milk fever symptoms, but a lot won't be. And you can see that those 2 different studies, study 1 and study 2, show that the prevalence of that low calcium, so below 2 megamoles per, or millimoles per litre of calcium, is quite prevalent. Maybe not so much in the lactation 1 cows, but actually that second study, the USA study, found that it was even prevalent to about 20% in the lactation 1 cows. But overall, it's about 40% of cows have subclinical hypocalcemia. And the importance of that is that, yes, the clinical milk fever cases are going to be very significant, but the ones that are subclinical, they represent a gateway disease because that hypocalcemia is associated with decreased milk production and also other problems such as retained fetal membranes. So hypocalcemia is one of those classic iceberg diseases where we recognize the very small percentage which are clinically hypocalcemic, and they're the ones with milk fever, and below that is the large number which have subclinical hypocalcemia. I said I'd return to the energy story. Considering that energy gap that occurs in this challenge period that's just before calving to around about a month or so into lactation, how can we help plug the gap, or what does the cow do to plug this gap? There's basically 4 approaches, and it can be, it's not a multiple choice, it's one or the other. Actually, all 4 of these processes very often occur. So the first thing can be we lower the demand for energy, and that's lower yields, and that can be done through breeding. So this energy gap is more of a problem. It's more of an issue in the high yielding herds. It's less of an issue in the spring block or autumn block grazing herds, for example, where the yields probably peak at 20-25 litres per day, and so there isn't such a big shortfall of energy, although those smaller cows don't actually manage to eat quite the same amount of dry matter intakes as housed Holstein cows. So there is still a gap there. The second thing is we can increase the energy density of the diet, just put more starch in, and we'll look at that. But I've already indicated that there's a limit to how far you can go in terms of megajoules per kilogram dry matter before inducing acidosis. The third thing we can try and do is increase dry matter intakes, and that's always got to be a focus of our attention, and it's something that vets can definitely bring to the table there, because we're looking very much at what the cow manages to eat, not what the diet looks like on the spreadsheet, and lots of things come into play there. For example, the feed space allowance, for one. And then fourthly, there's catabolism, mobilizing her own body reserves. And I'm just going to look at that one in a little bit more detail to start off with. So negative energy balance after calving is usually inevitable. I've described the reason why. Using ketones to some extent to plug that gap is normal. It happens. However, it is abnormal and unhealthy if those ketone bodies accumulate to excess, because that is when you get ketosis. Now, again, there's a clinical and a subclinical. Depending on what paper you look at, the definitions are sometimes different. But if we say that clinical ketosis is usually defined when there's more than 3 millimoles per litre of beta-hydroxybutyrate, indicates clinical ketosis. The incidence of this is very low. This is the instance of what I would have always called slow fever, because Yorkshire was my first job, and that's what everyone called it. In Cheshire, the posh farmers down here call it acetonemia. I don't know what people call clinical ketosis in your neck of the woods, but slow fever, acetonemia, not to be confused with acidosis in farmers' minds, or clinical ketosis. Not a high instance. However, subclinical ketosis, this is defined when, well, again, depending on who's defining it, but when the BHB levels are around about 1 to 1.4, again, it depends what the paper is or who's defining it. Now, the instance of this is a lot higher, around about 30 to 50% of all cows. Ketosis, it's sometimes described as type 1 and type 2. It's always taken me a long time to get my head around this, and then I read that it's a bit of a false distinction, because it's kind of based on comparing ketosis with diabetes in humans, where you got type 1 and type 2, where type 2 is insulin resistance and type 1 is just low insulin levels. It's kind of a little bit of a false distinction, so I don't stress about it. But type 1 typically occurs at peak yield when there is the massive energy need, but there's just not enough supply, therefore ketone levels are high, but the insulin levels are normal. However, or insulin levels are low. Type 2 is more when you've got high insulin levels and you've got insulin resistance, and this is immediately post-carbing, and it's associated with excess fat mobilization. Possibly a false distinction. There's a lot of overlap between the two types. I say don't stress. But how common is subclinical ketosis? Ketosis. Again, it depends where you go to find the evidence here, and it depends how it's defined and how the studies are done. You know, our cows tested every single day for the first 30 days or 50 days of lactation. I just tested once only during any of that 50-day period. But and how is it defined? Is it above 1? Is it above 1.2? Is it above 1.4 millimoles per litre of BHB? It depends. But the take home is that it's round about 40% of cows, high yielding Holstein cows, will be having subclinical ketosis. So ketosis is another classic iceberg disease, where the clinical ones are absolutely the tip of the iceberg, but this subclinical level is very, very prevalent. And it's an important disease because it's associated with a higher LDA instance, higher metritis, higher clinical ketosis. Obviously, you'd imagine if there's a lot of subclinical, there'll be a lot of clinical, but it also reduces milk yield by a lot, and it reduces fertility. So it's an important disease. Moving on though from ketosis, let's look at another strategy, which is increasing the energy density of the diet. This graph is showing the fine balance, if you like, that we have when feeding high-yielding cows. We can choose to feed a safe diet. This is a diet that digests very slowly. It's retained in the rumen for a long time to allow the rumen bugs to do their job and release as much energy from that diet as they possibly can. It contains a lot of ADF, which is acid detergent fiber, which is the undigestible fiber, the lignin, if you like, the stuff that means that the feed retains its bulk. It has a low energy density. It's safe. However, it's unlikely to contain sufficient energy, and because it sits in the rumen for a long time, it actually reduces dry matter intakes as well, that safe diet. So what do? Well, we might go to the other extreme, and we might put together a diet which has a lot of energy in it. We put more starch in it. We put more cereals in it. We reduce the fiber, so cows eat more of it. However, if we reduce the fiber, it doesn't sit in the rumen for quite so long, so cows don't necessarily get as much out of it as they could if it sat in the rumen for longer. But remember, we need to increase dry matter intakes, and one way to increase dry matter intakes is to reduce the undigestible fiber level. However, this is going to be risky for rumen acidosis and poor rumen health. So we need to be sitting in the middle. We're looking for this optimum fermentation rate where it's not too fast, it's not too slow, and we get a stable rumen pH. But it's a tricky area to find. We'll look at how the rumen pH is maintained and how the stability is retained in a high-yielding cow who's having quite a high energy density diet of, let's say, 12 to 12.5 megajoules per kilogram dry matter. But first of all, let's consider where the acid comes from. So the acid, in the first instance, is from volatile fatty acids, which is acetate, butyrate, propionate. Now, these are normal products of fermentation. It's actually what you want, because this energy, the VFAs actually provide around about 70% of the energy requirement of a high-yielding Holstein. So you want that acid to be produced. However, it's going to dip the pH of the rumen. And the normal rumen pH wants to be round about 5.6 to 5.8 for a high-yielding Holstein. For a cow that's on a low energy density diet, it's going to sit around about the 6.2. It's usually slightly acidic. There'll be something going wrong if it's not acidic, because it means there's no acids being produced, so probably no fermentation. But it doesn't want to go below 5.5. That 5.5 is a bit of a threshold. You want to try and stay above if you can. But that's where the acid comes from. And it's volatile fatty acids, and it should normally meet around about 70% of a cow's energy requirements. Now, when a cow eats, she also produces saliva, and that has bicarbonate in, and it tends to buffer. And when I ask farmers what their understanding is about buffering, they often mention saliva, because I think everyone knows that cows cudding and producing lots of saliva is a good thing, because it helps stabilize rumen pH. But it's not the most important thing, though. A greater amount of buffer, bicarbonate, is actually pumped into the rumen through the rumen wall. Now, not many people know that, but there's a bicarbonate exchange mechanism that's going on. Acid is absorbed into the bloodstream, so VFA, and bicarbonate is excreted into the rumen, and it's an active process. And that's a far more important buffering effect, actually, than the saliva. So acid's taken out, buffer's put in. And that is very, very dependent, the absorption of these BFAs, very, very dependent on a couple of things. It's dependent on a good blood supply to the rumen. It's dependent on a good rumen capacity, but it's very dependent on how much surface area the rumen has. And that's governed by a large extent by the length of the rumen papillae. And I'll show you a picture of those in a minute. Then eventually the feed, once it's been digested, will go into the abomasum, and this is your kind of bypass product. So anything that doesn't get digested in the rumen will get digested in the small intestine, and then from that point onwards, the cow is a little bit like a simple stomached animal. But to maximize our efficiency, we're trying to get as much energy, if you like, through volatile fatty acid production, through good rumen fermentation, which is why cows are such beautiful animals, because they can digest food that we can't, and pigs can't, and chickens can't. So cows as a ruminant are absolutely vital to our food production and efficiency by utilizing fibrous carbohydrates that other simple stomached animals can't. But they can only utilize it if the rumen is working at good efficiency. So here's the pictures of the rumen papillae. The picture on the left shows small papillae before any adaptation has occurred, and the papillae on the left are much bigger. You can see longer, bigger surface area. And the thing that governs the papillae length is the same in cows as it is in calves. And it's not fiber, it's starch. In particular, it's butyrate, but propionate probably has a role as well. So it's volatile fatty acids that are being produced by carbohydrate fermentation, which stimulate rumen papillae to lengthen. And that's why it's important to provide some starch in the dry cow diet, in particular the last 2 weeks before calving. I already had a question when I put the invitation for this webinar out. Straight away, I had a question, which was a good one, about the so-called Goldilocks diets and different dry cow diet strategies. I kind of haven't included any of the detail of that in this presentation, but if we want to pick that question up at the end, then I'm all for it. But essentially, you want to have a diet that doesn't get a cow too fat, so low energy, and yet starch. And that's where the straw comes in, because it dilutes out the energy of the starch. But if you just feed, let's say, poor quality hay to try and stop your cows getting too much energy in the dry period, there's not enough starch in there, and you won't get your papillae development. Therefore, the cow, when she calves, she has a small rumen surface area, and she'll get acidosis, or she's a very high risk for acidosis. So the rumen buffering, very important on that surface area, but there's other things that you can do and help with as well. And actually having a good match between the acid production and the acid absorption through the rumen wall is the key to this. And there's lots of things that will help that. So having good feed access and good space is going to encourage that little and often feeding. We want this little and often feeding bouts, so-called trickle feeding, so that the acid is being produced in small amounts throughout the day. It's not good to have a cow who gets hungry, for example, at 7 o'clock in the morning because she's had no feed available to her since 4 o'clock in the morning, and the farmer comes on with his mixer wagon and dumps a whole load of feed in front of the cows, and they go woof straight at it and perhaps have 30% of their total feed intake in that first big feed in the morning because they've been allowed to get hungry, and they'll have a drop in pH. And that's irrespective of whether they're getting concentrate in the parlour as well. Concentrate in the parlour in high amounts is also a risk for periods of low pH. So that kind of timing and management of the feed and what percentage of refusals you accept, in other words, the amount of feed that's left over at the end of the day or the start of the morning that you take away, is all part of the equation. Feeding the fresh feed twice a day as opposed to once a day will help. Having lots of push-ups will help. Having a diet that's difficult to sort will help, because if it's not, if there's a lot of sorting going on, the cows will have a tendency to eat all the concentrate in the first part of the day, and therefore increase the risk of getting acidosis. And then providing excellent access to clean water. Again, it helps spread out the feeding throughout the day. It helps this little and often feeding, and water is a fantastic thing to dilute acids in the rumen. Now, we looked at how common ketosis is and subacute ketosis. We looked at how common subacute hypercalcemia is. Now we'll just look at how common we think subacute acidosis is. It's another one that it's difficult to give you a definite answer, because it depends on how you define it and how you diagnose it. There isn't a blood test that you can do just to see whether the cow is acidotic or not. Basically, you need to measure the pH of the rumen, and there's pH of the rumen fluctuates throughout the day. So if you measure it at 10 o'clock in the morning, it could be very, very different to 3 o'clock in the afternoon. Subacute acidosis is best defined as either one of these two things. So it's either when the pH drops below 5.6. Actually, it says below. It says between 5.2 and 5.6, but below 5.6 for at least 3 hours per day. So a very short drop for a very short period of time is kind of normal, because you get that after a cow's had a feed in a lot of high yielding cows. But if it's staying low for a long period of time, then that would be a definition of subacute rumen acidosis. Sorry, I beg your pardon. I know why it says between 5.2 and 5.6. If it's below 5.2, it will be acute acidosis. The only way you can measure that long-term drop is really by having a rumen pH bolus, which are very expensive and not necessarily easy to use. And that would sit in the rumen for a long time to measure that pH over a period of time. They're very valuable to use. They're nice tools to have, but they're quite expensive to use. So an alternative, and this is something I've developed experience in practice, is taking ruminous samples from cows, sampling cows, usually in early lactation. There's a certain selection criteria that I use. And if more than 5 or more of the 12 cows sampled have a pH at that time point that's 5.5 or below, then that would diagnose subacute acidosis in that herd. So it's a little bit of a workaround. Now, when I have done that, and part of my work for my diploma dissertation a few years ago now, I found that there was a lot of cows that when you sample them at a single time point, they had pH below 5.5. And this graph shows a distribution curve of the pH values of 244 cows in around about 20, probably 30 herds that I was sampling. And it's a normal distribution curve around about a mean of 5.8. However, a quarter of those cows actually had a rumen pH of less than 5.5. So I think from that and other studies, I think we can say that subacute rumen acidosis is common. It's very common. And what are the effects? Well, subacute rumen acidosis, it kind of knackers everything up. The first thing that happens is it alters the balance of the bacteria population in the rumen. Below 5.5 promotes lactate-producing bacteria. Lactate-producing bacteria do what they say on the tin. They produce lactate. Lactate is a strong acid, whereas acetate butyrate propionate are weak acids. Therefore, as soon as you get that threshold where lactate-producing bacteria occur, you will have a further and steeper drop in pH. Then you get a reduced performance of the normal fiber digesting bacteria that like to survive at a higher pH. You also get a marked reduction of protozoa and protozoa activity, which again are important with fiber digestion. You then therefore end up with a less efficient rumen fermentation, and therefore you end up with a severe energy deficit. So you can try and plug your energy deficit by pumping carbohydrate into the cow, and you're having the exact reverse effect by inducing acidosis and therefore reducing fermentation efficiency. So you can actually exacerbate energy deficit by feeding more energy. I hope that makes sense. The other thing that happens is the cow stops eating. And don't forget, to try and plug this energy deficit, one of the key things is to increase the dry matter intakes. So you certainly don't want to stop your cow eating. So I've described this as a rapid disappearance down the plug hole of poor rumen health. You get a higher rate of bypass feeds, and that includes starch. So the rumen isn't doing its job. It can't release the energy that is potentially there in the digestible fiber. So a lot of the grass passes through the muck, or the silage passes through into the muck, and the energy in it has not been released. So you've got a greater negative energy balance occurring. And also, because you're getting feed passing out of the rumen undigested, and this includes the starch and sugar carbohydrates, you'll get a carbohydrate or starch overload of the small and the large intestine. And that's dangerous. There's a certain amount of starch that cows can cope with as a simple stomached animal, if you like, from the point where the feed goes into the abomasum and beyond. But more than about 2 kilos of starch per day in a Holstein cow will cause a lot of problems. You'll get secondary fermentation in the hindgut. That leads to an increase in lipopolysaccharides. They get absorbed into the bloodstream. They're associated with lowering immunity, probably anestrus as well. The thin cows bit comes in because you've actually increased the negative energy balance by giving her acidosis, but cows will go thin. The immunity drop comes probably due to increased lipopolysaccharides. And there's probably a lot more else which is yet to be understood. So we've got 2 things going on. We've got less efficient rumen fermentation, and we've got starch overload leading to secondary fermentation in the large intestine, which is poisoning the cow. It's two things. The lameness, often associated with SARA, probably the link is that the cows are going thin. Anything that makes cows go thin increases the risk of clawhorn disease, for example, sole bruising and ulcers, and that's probably due to the less dense fat pad in the foot. So yes, lameness with acidosis, yes, but it's probably not laminitis in inverted commas. It's probably just thin cows. So we're walking the tightropes here when feeding cows. Too much energy density, acidosis risk, that's going to drop the dry matter intake. That's going to actually increase the negative energy balance. Too low energy density diet, well, that's a ketosis risk. And again, that's going to reduce the dry matter intakes, and it's going to make the situation worse. So what's our roles? I think there's a few things that we can do. The first thing is, as vets, I think we have a unique viewpoint. Hopefully we understand the biology of what's going on. Hopefully we understand that it's about feeding the cows and it's about feeding the bugs. And when we're feeding dairy cows, it's always good to remember that we're feeding that rumen microbiome. That's the bit that is the energy driver for cows. So we must keep a focus on that. We must have a deep understanding of that biology. Second thing, we have a fantastic opportunity to spot when there's a problem. We're on farm a lot. If it's routine fertility visits, then it's often fortnightly. We are in an ideal position to spot when cows are looking empty, when the rumen is looking hollow, for example, on this cow, when cows are presented to us for PD or for not seen bulling, and they're just anestrus, they're skinny. We can spot when there's a thin cow lameness problem going on. We are in a good position to spot when problems occur. But then we need to have the know-how how to work it up and to monitor. Now that can be as complex, or if you like complex, I don't think it is particularly complex, but as complex as taking rumen fluid samples and monitoring pH, or it can be as simple as putting in place a ketone monitoring system that the farmer can do themselves with a drop of blood from the tail vein. I think another role that we can have is always being on the cow's side, the cow advocate. There's a lot of pressure on dairy farmers and their cows to be more efficient, and sometimes those efficiencies are kind of they're ill-gotten gains. And by this I mean, there's a bit of sometimes a push from someone or some advisor. I'm not blaming all nutritionists on here, but sometimes it comes from a nutritionist who's looking to a new nutritionist on the farm who's looking for quick, easy wins in terms of getting the farmer on board. And that's often by producing more milk, by stuffing more starch into the cows. But we actually should always be on the cow's side and think, well, actually what's best for the cow? what effect is that having on cow health? So always being on the cow side, always thinking of things from the cow's perspective is a really valuable role, just to allow people to take a step back and just see the consequences of some of the things that we're asking our cows to do. And then I think the other thing that's important, I guess, in our role is knowing what our limitations are and also where to go for help. Feeding cows and avoiding these problems, it is a multi-pronged approach. There are things that we can bring to the party without a doubt, but there are also things that trained nutritionists can bring to the party without a doubt. So those are the things that I'll leave you with, if you like. This is what we're trying to avoid. We're trying to avoid downer cows, hypercalcemic cows, cows with ketosis, cows with LDAs. We know it doesn't always go right. This is when it goes wrong. Sometimes farmers blame it on bad luck. Well, we all get our bad luck days. And before I hand over to Charlie, I'll just leave you with this. There's always someone who's having a worse day than you. So that brings me to the end of that kind of run through, if you like, of some of those challenges. I will now hand over to Charlie. There'll be just a 10 or 20 second break where we hand over, and then we'll take questions at the end, if that's okay. So Charlie's screen is coming up now. Okay, Charlie, if you just remember to unmute yourself and you can go.
There we go. Can you all hear me?
Yes.
Okay, good. Good afternoon, everyone. I'm Charlie Sullivan, vet with Bioenergy Ingredients. My internet connection was starting to wobble a bit there, and I thought what a bad day I was having until I saw the poor animal in Owen's last slide. So yeah, someone's always worse off than you. Thanks very much, Owen, for very clearly setting the metabolic scene for the transition period. I'm now going to talk a little bit about Glycal Forte, what it is, its modes of action, how it's used, and what we see on farms. First of all, just a little bit of background about the product. It's well known that glycerol has been used to drench ruminants for ketosis for many years. And with more glycerol available on the world market as a byproduct of biodiesel manufacture, BEI set out to make a more user-friendly form of the compound to improve on that viscous drench we all know. Eventually, a process was developed where glycerol was heated with a calcium source to form an easily handled powder. Now, this powder is there we go, it's an ionic complex of glycerol, calcium ions, and hydroxide ions. So in this diagram, the black is carbon, red is oxygen, and white is hydrogen. So the glycerol is that 3-carbon chain in the middle. And at higher pHs, the complex is bound together as an insoluble powder, as in the diagram here. But as the pH drops, this complex dissociates into free glycerol and soluble calcium and hydroxide ions, as in the diagram on the right. So at pH 6 or so, which is optimal rumen pH, about 25% of the powder is dissociated. At pH 5.5, which is a more acidotic rumen, about 50% is dissociated. And at pH 2 to 3, which is what we'd find in the abomasum, more than 95% is dissociated. But the important thing is that across a range of rumen pH values, the lower the pH, the more hydroxide ions are released to neutralize those excess hydrogen ions and raise the pH back to more optimal values. And knowing this chemistry sets a scene and just allows us to understand Glycal Forte's modes of action. So most importantly, it regulates rumen pH at about 6. And I think perhaps my normal and acidotic values, which I'm quoting, are maybe a little higher than Owen's. And Owen and I can maybe discuss this in the questions afterwards. But I think Owen's figures, if he's doing rumenocentesis, will come from the rumen. And the figures that I'll show come from boluses which sit in the reticulum, and the reticulum always has a slightly higher pH than the rumen. So it regulates rumen pH, and I'll come on to the next slide about the effects that has. Glycal Forte also provides calcium. Now, it's not a milk fever prevention strategy. That needs to be addressed by other ways on farms. But Owen did put some context for subclinical hypocalcemia, and low levels of calcium, subclinical levels up to about a week or two after calving, can act as this gateway condition and increase the chances of adverse effects. So providing calcium can counteract that. It also supplies bypass glycerol. As I said, depending on the rumen pH, approximately 50 to 75% of the total glycerol in Glycal Forte is released in the abomasum, which means it bypasses rumen microbes, and then it can be absorbed directly into the portal circulation and taken to the liver, where it's very efficiently used as a glucose precursor. But glycerol in the rumen, on the other hand, and that's whether it's from Glycal Forte dissociating there or even drenching with liquid glycerol, is used much less efficiently. There's significant energy loss through gas, methane, and carbon dioxide. But as I said before, the biggest benefit from Glycal Forte is maintenance of optimal rumen pH. And suboptimal rumen pH, when it's low, acidosis, has a detrimental effect in the rumen in two ways. Firstly, it has an effect on the rumen microbes, and in particular the fiber digesting bacteria. So that leads to a reduction in the fiber rumen degradability by up to 20%. And there's also an increased maintenance energy requirement for those bacteria at low pHs. And secondly, a low pH damages the rumen epithelium. That increases the permeability of the epithelial barrier. That leads to reduced dry matter intake. And more recently, the leaky gut theory suggests that leakage of compounds, especially endotoxin, the lipopolysaccharides, which Owen mentioned, from the gut to the portal circulation liver, sets up an inflammatory state in the body which consumes energy. It wastes energy that's no longer available to the cow. So when looking at the low rumen pH, I've concentrated on its effect on energy balance, since that's most important for the transition cow. But these same two targets, so the rumen microbes and the epithelial layer, they're also responsible for the other signs of SARA that we see throughout lactation, instant scouring, low milk fats, which Owen described earlier, but I won't go into more detail about those now. So that's a bit of the science behind how it works. And before I go on to what we see on farms, we'll just have the third and final poll question here. So what proportion of your dairy herds have a separate and manage and feed separately a fresh cow group? Or what proportion do you think could do so? And I think, Owen, I've got to be reliant on you to, oh, there we go, put the survey box up. So I'll just give everyone a minute or two and see what general consensus is. While we're just waiting for that box to be filled in, I'll just give you some of the background of the next thing I'll do is describe a trial, a controlled trial that was done with Glycal Forte. So this was done on a controlled trial in a herd with giving almost 10,500 liters. And before I carry on there, we'll just look here. So, okay. Right, so what proportion? So sort of 20 to 60% of herds, about half of you thought approximately half-ish or a third-ish of your herds fed or could feed fresh cows separately. Okay, that's great. That's interesting to know. Thank you. So going back to our controlled trial, we used a farm. The herd was giving about 10,500 litres at 4.29% fat and 3.4% protein, with a calving conception interval of about 100 days. So it's a pretty well managed herd. 94 cows were enrolled in the trial in 2 groups. One was fed Glycal Forte, and the control group was balanced for calcium and the energy contained in the glycerol, not the energy that could be accrued from pH improvements. And the cows were then allocated to 2 groups, basically mainly alternately as they calved, while at the same time we're trying to allocate them so we minimize any bias in terms of parity or body condition score. And 5 cows in each group received a rumen pH bolus. And the reason for that is, as Owen alluded to, they're quite expensive bits of kit, so 5 cows in each group rather than 45 were done. So the first thing we'll look at is the rumen pH for the 3 weeks after calving. And 2 things I'd like to point out here. Firstly, in the control group, which is the blue line, and even in this very well managed herd, there's a dip in pH, certainly for 2 to 3 weeks after calving. And you know, this will reflect that period of rumen adaptation where the rumen papillae are still developing that Owen talked about. The second thing to point out is that dip is much reduced in the Glycal Forte treatment group. And we see that quantified also in this chart, which shows the hours the rumen pH was below 6. About half the time in the treatment group compared to the control. We also looked at body condition score, and we can see that the treatment group lost less body condition. There was a series of production, disease, and fertility parameters we also analyzed, but there weren't statistically significant improvements, except for in 2 parameters, in cell count and lameness. Now, I have to acknowledge that this was set up as primarily a nutritional trial, and so cows were allocated to groups as I described before: calving date, body condition score, and parity. So they were not allocated according to historical cell count or lameness data. But notwithstanding, there's a difference between the 2 groups. On the left, that's the cell count chart. So the treated cows had lower cell counts. It's recognized that an increased depth of negative energy balance post-calving is associated with a reduced immune system function. So improvements in energy balance lead to a better immune response to infection, and certainly I think that can explain the beneficial effect on cell count. The right-hand chart is looking at lameness, and again, luckily, Owen and I are singing from the same song sheet here. You see lots of work coming from North America linking low rumen pH with laminitis, but researchers in the UK are much less convinced about that, and certainly a more accepted explanation of this finding, I think, is that improved energy balance leads to less fat mobilization, reduced body condition loss, and less thinning of the digital cushion, which is recognized to be an important factor in lameness development. This is a pH chart again from this was a small trial that was done on a commercial UK dairy farm, only 7 cows in each group, and 3 of them received pH boluses. But again, the ratio of hours, less than pH 5.8, and this one is similar to the previous trial. And also on this farm, the blood parameters looking at energy status were improved in the treatment group. So lower BHBs, higher glucose, lower NEFAs, and also approximately an extra 2 liters of milk. Just a final chart to show you. This is from a Danish dairy farm, 1,300 cows, giving about just over 9,500 liters, pregnancy rate of 23%. And their problem was they were getting a lot of cows with ketosis soon after calving. And so this is pre and post adding Glycal Forte to the ration. We can see that ketosis cases reduced and milk yield went up, again, by about a couple of liters. So Glycal Forte has been fed on several commercial UK dairy farms, and certainly the commonest comment that farmers make is the improvements seen are less loss of body condition and cows get back in calf quicker. And this is a series of 5 farms that it's been fed. Again, this is a before and after comparison, looking at pregnancy rates, showing the improvements that farms have seen. I appreciate that some of these results that I've put up are probably best described as anecdotal, and we are aware that we need some more robust control trial data. Cows are currently being enrolled in a trial on a couple of commercial dairies, where we will recruit a minimum of 800 cows and follow them through lactation to get full fertility, disease, and production data. And we'll look forward to having those results out sometime early next year, 2021. So when to feed Glycal Forte? Well, we recommend feeding it to close-up dry cows, so that when cows calve down, the Glycal Forte is having its full effect already, and the rumen is giving every chance to minimize the health check that it inevitably suffers at that time. Then feed it for that period of rumen adaptation. Can take up to 6 weeks for the papilli to reach full size. Obviously, this has to fit in with feeding groups on farm. However, when herds are seasonally calving, and this is topical as we head towards autumn calving herds, and they'll be looking at the next 2 or 3 months, those autumn calving herds could feed milkers for a reasonable period of time and still have a large part of the herd in that critical transition window. Heat stress is also associated with rumen acidosis. Cows increase their respiratory rate to lose heat, which leads to a metabolic alkalosis, and then less bicarbonate available for rumen buffering, as Owen said, both via the saliva and across the rumen wall. There's also a loss of saliva, with cows tend to drool during heat stress periods. In addition, they'll eat less in the heat of the day, leading to a smaller number of larger meals when it's cooler. Dry matter intake reduces, and rations are usually designed then to have a higher than normal energy density to compensate, often by increasing sugar and starch. And as Owen alluded to, these are all then risk factors for rumen acidosis and low pH. Heifers are more at risk, and so if farms have a separate heifer group, then consider feeding them. But finally, in my mind, the term SARA, often you think of situations where the whole herd or even whole groups in a herd, for instance, the high yielders are suffering from these symptoms of low rumen pH, variable intakes and yields, condition loss, scouring, low milk fats. And this may be because the herd is being pushed to maximize yields, as Owen said. Perhaps they're nutritionally pushed too hard. Maybe there's a fiber to sugar starch mismatch, or some other aspect of feeding the herd. In these SARA situations, Glycal Forte could be used to correct rumen pH, perhaps in the short term, and it will certainly be effective. However, often the long-term cost-effective answer will be to look at the ration and feeding management of the herd. But this is a conversation for a farmer, vet, and nutritionist on an individual farm basis. But overall, the main target group that will benefit from Glycal Forte are cows in the first month or so after calving. And then a final slide here, and I think some of you may have seen this. is to mention the support that we give the product. This enables practices to do some regular BHB testing and data gathering, and we can certainly follow this up with anyone who's interested. So finally, thank you very much for your time and interest, and thank you very much, IVC Evidensia, for giving us the chance to present this webinar. And now I think I better hand back to David, and Owen and I are available to answer any questions.
Thanks very much, Charlie and Owen. Thank you. We've got a few questions on the Q&A, so we'll just have a look at those. Mike asked near the start, what are your views on particle type separators and also overzealous mixing and resulting issues? Finally, any tips for feeding very high dry matter silage? Either of you, I'm sure, could contribute to answers for that.
I'm easy. What do you want to do, Charlie? Do you want to take that one, or are you happy with me? What do you want?
Well, you start off with that one, Owen. And
okay. So yeah, particle separators, a great little gadget really, and I have one, and I think it was valuable, even though it cost me 400 English hard-earned pounds to import it from America for a bit of plastic with holes in. But I don't regret it because I use it and I find it valuable. I find it very, very valuable to see how much sorting is going on. So it's kind of part of building up a picture of what's going on farm, Mike. It's kind of. It's not the be all and end all. It has a lot of limitations as well, particularly when you're using it with diets that contain a lot of grass silage, which can clump. And it's certainly not used in the same way that the Americans would use it, or North America would use it, where they kind of have they kind of have target volumes or weights actually of the total mixed ration in each sieve, which are very hard to interpret or use the same targets in the UK on our grass silage based diets. So it has a value, but limited, and it's mainly for, in my view, for seeing how much sorting is going on, because you can sieve a diet as it's first fed out, and then perhaps three hours later and see what the differences are. Second part of your question, I think was overzealous mixing. Yeah, do you know? Traditionally, I would look at a TMR diet and I would want to be seeing it as a nice, fluffy, open diet. And I've had to question my previous assumptions, particularly when looking at some farms that are very, very successfully doing something called compact feeding, which to all intents and purposes looks like they're macerating the diet to a pulp. They add a lot of water to it as well. And it makes almost like a clod-like diet, which you look at and you think, oh, that doesn't look very open and not very fluffy. That can't be good for rumen health. But conversely, actually, it can have a very good effect on rumen health because it almost eliminates sorting. Those diets cannot be sorted. It also, because it contains a much higher water content, fills the cows up, so it can promote this little and often feeding rather than the diet that might be a traditional open, fluffy TMR diet that's a lot drier, and cows can gorge themselves on that. So they can end up with having sort of 3 feeds a day as opposed to what you want is 9 feeds a day. So yeah, that overmixing, it can be a problem, but maybe not as big a problem as we've felt previously. Fiber levels are important, but you don't need to be very long. It doesn't need to be very long fiber for it to be rumen effective fiber. Charlie, do you have any comments on that?
Yeah, certainly. I'd back up what you're saying about the compact feeding, Owen. When I first saw it on farms, I thought, yeah, I'm not sure how this is going to work. But actually, it does seem to work well. And herds that use it, the cows do look well and perform well. Yeah.
Okay, cool. Should we take another question, David?
Yeah. Let's
get through.
Yeah. Olivia was asking, how reliable is keto monitoring in milk in fresh cows versus farmer bleeding tail veins?
I think this is milk versus blood. I think it comes down to personal preference. Is my short answer.
Yeah,
I don't stress about it. If milk's more convenient, the farmer's going to do it. Go for milk.
And then the second question from Olivia was, do you find that higher or lower than target body condition score at calving is a greater risk factor for SARA? And she comments she possibly sees more ketosis in over-conditioned cows.
Yeah. I'll go first on this, and I'm very curious to know what Charlie's response is.
Yeah.
So fat cows, risk for ketosis, no question.
Yeah.
Fat cows, risk for SARA, Probably not. I think the preconditioning of the rumen is the risk factor for SARA, coupled with how the diet is presented post calving. SARA, thin cows and fat cows, in my opinion, are equally susceptible to SARA. That's my thoughts. I don't know what Charlie's thoughts are on that.
Yeah, I think I agree with you. I think SARA is probably independent of body condition. I think what body condition does is affect intakes. And years ago, Phil Garnsworthy at Nottingham did some really nice work, which showed that whatever condition cows calved at, and probably they were ranged from, I don't know, 3.5 to 2 or something, they all kind of met in the middle at about 2.5, 3-4 months after calving. So the fat cows lost condition and the thin cows gained condition. So I think it's intakes rather than SARA, which is the big, what is influenced by body condition.
Yeah.
Great, thank you. A nice one from Mike again. Thoughts on the importance of rock salt, especially for cows fed maize silage?
Yeah, it's very sensible. Salt tends to increase water intakes as well. It can also help with those dry matter intakes. So I think it's a very sensible thing to do.
Yep, good. I think we've got a good audience here, and we're 5 past the hour, but we'll just a couple more questions. Charlie, what's the cost per head when Glycol Forte is used according to your recommendations?
Well, recommended dose rate is 250 grams per cow per day, and currently the cost is about 60p per cow per day, which is in the same ballpark as things like choline, other additives that you might get in that fresh cow period. And the key to it, though, I think, is restricting its use to when it's going to be effective. And this is part of the, if it's fed for approximately a month after calving, a little bit before calving as well, then the return, the cost benefit is there on farms.
Great, thanks, Charlie. And I think we'll just take one final question from Ronan. Should Glycol Forte be fed in advance of calcium?
I think actually, David, the question was how. I think the typos coming through. I think the question finally was how long before calving should Glycol Forte be introduced, which I think Charlie's partly answered, but I don't know if you want to come back.
Yeah. I'm sorry, I've seen that now further down.
Yeah, what we'd like to see is Glycol Forte in the ration, in the rumen, having its full effect, so you have a nice stable rumen as the cow calves. And that probably takes 3 or 4 days. So, say a week before calving, but I'm conscious it will also depend on what feeding and, close-up management systems will be used on any one farm. But for several days before calving would be ideal.
Great, thanks, Charlie. Well, I think, Owen, Charlie, it's left to me to extend a huge amount of thanks to you for 2 great presentations, stimulated a good bit of chat, and also just to say thank you to all the participants for coming on board on a Wednesday, middle of the week. They probably had long days and they've all stuck there with very few people having to dash off, but it's been a great talk. Really, really appreciate it. And thank you once again.
You're welcome. Thank you.
Great.
Thank you, David.
Thank you very much, everyone.
Yeah.
Okay.
Thank you.
I know Charlie's keen that if people have any more questions, Charlie, you said you were very open for people contacting you directly using the details on the screen.
Yeah, do.
And certainly I'm always happy to answer questions. And I know, David, it was disappointing that we had to cancel some planned CPD, hands-on CPD for IVC, where part of that was actually doing rumen health visits, including rumen centesis and using particle separators, etc., and really getting a little bit more depth on the issues that we've touched upon today. So post COVID-19 restrictions, hopefully we can get something back in the diary again.
Absolutely, Owen. Yep, definitely. It'll be on the agenda for sure. Yeah. No, that's great. Thank you both very, very much. Great afternoon. Really, really enjoyed it. Great way to end the afternoon. So thanks ever so much.
Okay, lovely. Thank you.
Thank you then.
Thanks, everyone. Cheers.
Okay,
Bye-bye.
bye now.